Hi everyone, welcome to this week's health tip. So this is the final question in my series of questions about reflecting on myself and my profession and the work that I do. So the last question in the series is, what is the most amazing miracles I have seen in my practice applying network care? So obviously there's lots of miracles that happen all the time, people with knee problems for 15 years that finally go away, and people that have had headaches that finally go away after they've had them for many, many years and things like that. So I'm just going to focus on a few kind of specific sort of unique ones. So when I was working in Italy, there was a little baby that was brought to me that was sort of, we say, hemiplegic. So on one side of the body, the baby wasn't really connecting with one side of the body, so it was moving this arm and this leg, but not so much on this side after the birth process. And just doing some network care, the baby started to unwind, and slowly they saw that this hand was starting to move and that leg was starting to move, and the baby kind of basically recovered full function on both sides of the body. So that was a pretty big one. Obviously, I see a lot of kids on the spectrum, and we've had some autistic kids here, that initially come and they're spinning around and yelling and screaming, and they're trying to do ABA, which is like a behavioral care for these kids, and trying to get them to behave certain ways. And the therapists are saying, that the kid's very challenging and they're having very low scores, and then they start to bring the baby here. We start to do our network care. Also, I do integrating the functional neurology work, spinning the babies or adjusting one side to stimulate the weak parts of the brain. And then they'll come back and say, they're staying longer for their ABA, and they're more focused and spinning less, maybe stimming less, and less pushing and pulling on people, and less aggressive episodes and things like that have happened, obviously, too. There's one episode of a lady. She was a senior citizen, and she actually had a condition. It's called dropped head syndrome, where some people say it's like a variant of Parkinson's or some sort of neurological thing, but basically her actual body, she had totally lost control of her head. So her head would actually be down like this all the time. So to go out in public, she would actually wear a hat that had suspenders pulled here, and it would pull her head back. And they would attach the suspenders to her waist at the back on the belt, and that would keep her head up. And so we started working on her, and I said, well, her life was pretty drastically demolished at that point, right? So as soon as she'd take the hat off, her head would just drop and stay down like that. So she used to play the piano, she used to be dancing and things like that. And I told her, well, you're going to stick around, we're going to be with this for quite a while, maybe in around 8 or 9 months, we're going to have you dancing with your husband again. And she actually came in January, that's when she started care, and more or less around October, November, she came into the office and she said, I actually went dancing with my husband, and over time her head actually got its stability back and it started to come up again. So she was actually, looking around, and her head was more or less back in a normal position. It took quite a while, a number of months, but that actually was one of the main amazing things with that one. So the final story I think I'm going to mention is this one. So this happened when I had my office in Italy. So there's a kind of concept. When we're doing network care, we're doing the light touches, we're sending signals to your brain so your brain perceives your body better. So most of my patients would kind of understand that as perceiving like the bones, the muscles, and the spine, and where you are in space physically. We would call that maybe proprioception, meaning where you know where your joints are in space. There's another sensation that's all part of your nervous system that's called interoception, and that's where you perceive your internal organs. If you get something stuck in your throat, you feel it. If you have a big gas bubble in your intestine, you're going to get this really crampy kind of jabbing pain. And interoception also helps you know when you have to go pee and go poo. So a lot of kids that are on the spectrum, they have a very sort of challenged nervous system, and they don't feel their body in space. They don't feel where they are. They don't feel connected, and they also don't feel the inside of their body either. And so often, many of them have they're not potty trained basically. So they're always in diapers. So many younger kids have been brought to me here, and over time we've worked on them, and they start to go, know when they go to the bathroom and they start to get potty trained, after they might be older, as opposed to maybe happening at 1 or 2 or 3. It happens, when they're bringing me a 6-year-old, and this might start happening. But in my office in Italy, there was a family that started care, and they had an 18-year-old boy who was a pretty big, husky, autistic, nonverbal kid who would, flap his arms and kind of spin and things like that, but never potty trained. So he always had a diaper with him all the time, and he would just poop in the diaper, and the mom would change the diaper. So after only about 3 or 4 weeks of getting the network care, when I was doing the touches on him, you could see he was breathing and moving his body and responding very well. And after about the 3rd or 4th week, the mom came in, she was crying, she goes, he just walked right over to the bathroom and he pulled down his pants and his diaper and he sat down on the toilet all by himself. And from that point on, he actually could feel when he had to go to the bathroom. And that was a big change for that family, obviously 18 years of this, non-trained, not potty-trained child. So that was one of the really big dramatic ones because that really impacted that family's life, obviously. So obviously there's lots of miracles that have happened over the years, but I just try to pick out a few sort of interesting ones to kind of give you the idea of how deep and how far some of this stuff can go with people's bodies. And so that's why I'm so passionate about network care and chiropractic and neurology and all those kind of things that I'm always trying to improve and be the best I can so I can be the best for you guys. So that's my story, my 5-question arc in chiropractic and network, and that's it. Hopefully you enjoyed the series, and we'll see you in the next health tip on whatever it'll be. Take care. Next time.